Hi, my name's Lynn. I'm 47 years old. When I was 30, I was diagnosed with a cerebral epidermoid cyst. This is basically a tumour on my brain, which grows very, very slowly. So it took 30 years to actually start causing me problems. What it did do is it started getting bigger and putting pressure on my brain. And this started then affecting things like my hearing, my balance, caused nausea, vomiting, coordination, mobility problems. Unfortunately, there's no actual cure for it. And what does happen is I go for surgery, and they actually drain the cyst, which is quite invasive surgery and quite dangerous as well, because there's no other method. It can't be cured by lasers or radiation. It has to be very precise. So it's quite a risky business having the surgery. I've been 4 times so far, and what this does is lift the pressure off my brain and reduces the symptoms again, so I can then sort of carry on with my life as it is. Before I became ill, I worked in quite a variety of different professions. I was a psychologist initially. I worked in social services, child protection, education. I eventually worked in as a psychology lecturer. I think the reason it's important for me to explain this to you is I like to try and get away from the fact that with patients and professionals it's an almost us and them scenario, because at the end of the day we're all people. And the reason I say this is because if I'm talking to professionals or students, I want them to realise that at some point in the past I was a student, I had to do assignments, I had ambitions, I wanted to move forward in my career, various things like that, but obviously this was affected by my health. That's why at the end of the day I decided that because it was interrupted so often with various jobs, that I would use this situation to actually try and educate people about the patient pathway. When I talk about educating people about the patient pathway, it's more of a raising awareness, sharing perspectives. Nothing I say is set in stone. It's just a combination of my experiences and situations I've come across, and it's just to offer some input really, so that people might think about, consider what I say. I think one of the main things that I'm trying to get across is the actual patient pathway, which is the term used on this journey that patients go on. I think just the very term itself, patient pathway, suggests a sort of smooth, continuous road that patients go down. One of the main things that I've realised is it's actually far from that. I always describe it as more of a set of stepping stones. There's lots of gaps, because as I talk more about things, perhaps I will try and convey how each step is very, very isolated, dealing with one professional, then the next professional, or various situations. So what I'd like to do is to try and increase awareness so that maybe we can make the pathway a little bit smoother and more continuous. The other thing I would say is, again, people often get involved at certain points in the pathway, whether it's offering therapy, giving treatment, doing scans. So they have, often a long input, but never as long as the patient's, because the pathway does go on, as you'll see, and really it's the patient is the only common denominator. It's a very long, arduous journey really, and I think that's why it's important if we can try and make that as smooth as possible, not just for patients but for therapists and people working with them, because people are trying to help patients. That's the whole aim of it. So if we can work together to try and increase that and make things as easy isn't the word, make it as less stressful as possible, should we say.